Good morning, my name is Marco Ladetto. I'm assistant professor at the University of Torino, Italy. I'm here charged presenting the results of a study entitled Long-Term Molecular Results of the GIMEMA VL-03-096 trial on molecular remission achievement and loss of molecular remission as major outcome predictor. The answer is presented especially on behalf of my colleague Dr. Simone Ferrero, who is not here. So this is an update of a previous trial in which we investigated the effect of a VTD consolidation in order to obtain molecular remission and to see if this was predicted for outcome. Now we have a much longer follow-up and the results are now presented with a much more mature result. The previous trial was being published in JCO 3 years ago. Patients were eligible for the study if they had achieved a good response after autologous transplantation and if they had a molecular mark based on immunoglobulin heavy chain rearrangements. Patients were then treated with VTD consolidation and monitored at several time points to assess the status of molecular remission. Well, the treatment was overall very well tolerated and we had no toxic deaths and most of the patients were able to comply with the treatment. Moreover, most of the patients were able to comply with the molecular follow-up, including bone marrow examination, that allowed us to draw these very important results in terms of molecular remission. We observed that a consistent proportion of patients achieved molecular remission either by real-time quantitative PCR or by nested PCR. And the most important result is that the patients who achieve molecular remission have a much superior outcome on the long term. And if molecular remission is lost, the possibility of relapse becomes much higher. This is really an interesting point as it allows to have a tool that can suggest to you if the patient is going to relapse. And the other important point is that for most of the patients there is a quite prolonged therapeutic window in which the patient becomes again PCR positive, and then you can start hypothesizing future trials to make some intervention by any kind of treatment, for example by lenalidomide or other treatments, in order to induce this patient back to molecular remission. This is somehow, as has been already observed in other diseases such as mantle cell lymphoma. The conclusions of the study are that achieving molecular remission is an important goal. The more you reduce the tumor burden, the more you have chances to survive for a long time in good shape, and thus that future treatment must be aimed at achieving the maximum level of response in multiple myeloma as in other lymphoid tumors.